All right, so I think we'll get started here. So I want to welcome you all. Thank you for joining us on this webinar today. I'm excited to speak about how to reduce your cancer risk with the right nutrition. Before we begin, I just want to mention that this webinar is not a substitute for any professional medical advice, diagnosis, or treatment. It is strictly for educational purposes only. And if you have any questions or health concerns, it's best to consult your family doctor or naturopathic doctor. My contact information is also provided at the end of this presentation. So if you want to reach out to me, you can do so. And then you could also schedule a complimentary free 15-minute consult as well. So just before we get started, my name is Irina. I am a naturopathic doctor based in Toronto, and I practice out of Higher Health Center. I maintain a general practice, but I also have an interest in integrative cancer care. So I really do believe that naturopathic medicine has a place in all stages of conventional cancer care. It can effectively improve quality of life, enhance benefit from conventional care, speed up post-surgical recovery, as well as minimize any side effects associated with chemotherapy or radiation, and prevent recurrence. A bit of background knowledge about me. I did complete a 4-year Doctor of Naturopathy program at the Canadian College of Naturopathic Medicine, as well as a 1-unit internship at the Integrative Cancer Center, where I gained additional clinical experience working alongside other naturopathic doctors to support individuals affected by cancer. During my undergraduate studies, I worked for over 3 years investigating how nutrient deficiencies can affect cancer growth. And it was during this time that really sparked my interest in this particular field. From my experience, I learned a lot about how one's diet can influence the development and growth of cancer. And hopefully today I'll share with you some of my knowledge and experience. So just a brief overview, this is a 30-minute presentation where I'll be going over some of the problems with our current diet, as well as why we are eating this way. I'll also be going over any associated risk with foods we are currently eating. So really diving into the research into particular food items and seeing if there's any risks with the incidence of cancer. I'll also be going over functional foods for cancer prevention, some of the most frequently asked questions as well. And then lastly, practical tips for a healthy and sustainable diet. So between work, school, family, and social life, our increasingly busy schedules have really started favoring convenient food items that can quickly satisfy our cravings. So maybe we could all relate here. It's become increasingly difficult to make healthy and nutritious meals all the time. And over time, we have probably lost touch with where food really comes from and how it's prepared, with the introduction and rise of food processing and preserved and packaged food items and microwavable meals, for example, drive-throughs, food delivery services, you name it. The SAD diet, or the standard American diet, is a modern day diet that has been attributed to poor health. So some of the issues I have with the standard American diet is that it's highly processed, meaning that essential nutrients are lost through the processing. It's also pro-inflammatory, so over time, this can damage healthy cells, tissues, and organs. It has artificial colorings and sweeteners, which in high amounts can be toxic to the liver as well as other organs. It's also high glycemic, so this means it has lower fiber content and higher blood or higher sugar content, meaning that it creates these spikes in our blood that over time can lead to poor blood sugar control and diabetes. It's also low in fiber, which can promote poor blood sugar control, as well as elevated cholesterol levels and poor digestive health. As we know, the good bacteria in our gut does feed off of the fiber. We know that it's often sprayed with pesticides and fed with additional hormones that can be toxic to humans and also affect our delicate hormone balance. It's also high in sodium, which can lead to risks of high blood pressure as well as heart disease. And lastly, it's high in trans fats and saturated fats, which can lead to obesity, the buildup of fatty deposits in our blood vessels, which is known as atherosclerosis, and this can lead to heart disease as well. So this graph here shows the rate of cancer incidence and mortality since 1975 to year 2018 in the States. As you can see, between the year 1975 to approximately year 2000, there has been an increase in cancer incidence and mortality rates in both men and female. And this trend has been connected on multiple accounts to increased intake of unhealthy fats and sugar and cholesterol. You will also notice that there is a slight decrease after around 1995 to year 2000, and this most likely is due to increased cancer surveillance, advancements in cancer treatments, as well as cancer prevention programs like nutrition and physical activity programs and other metabolic risk factors too. So it's important to recognize that it's not simply a matter of individual choices, but it really is a more complex issue that involves government bodies and societal pressures, businesses and corporations leading us to eat this way. We are seeing that over time, fresh and perishable food items have become less accessible and less affordable, meaning that for a lot of people, eating healthy every day is not a viable option. Meanwhile, at the same time, we're seeing that junk food has become more widely available and more accessible, more affordable, and also very intensely marketed, especially towards lower income communities, as well as children, as you can see on the picture on the right here. So now let's get into the nitty-gritty in terms of what risks are associated with certain foods we are consuming in high amounts of. So researchers looked into the incidence of cancer in those who consumed the highest amount of red meat compared to those who consumed the lowest amount of red meats. And they found that it did increase the breast cancer incidence by 9%. It increased colorectal cancer by 10%. There was a 26% increased risk of lung cancer, as well as a 22% increased risk of liver cancer associated with red meat consumption. Similarly, when they looked at those who ate the highest amounts of processed meats compared to those who consumed the lowest amounts, they found a 6% increased risk of breast cancer, 18% increased risk of colorectal cancer, a 12% increased risk of lung cancer, as well as a 24% increased risk of stomach cancer. There is a 12% increased risk of cancer associated with sugar-sweetened beverages like sodas and fruit juices. But more importantly, consuming excess high glycemic foods. So again, these are the foods containing high amounts of sugar, low amounts of fiber. This can contribute to the development of type 2 diabetes, which has been strongly linked to various cancers, including cancer of the bladder, cancer of the breast, liver, kidney, and pancreatic cancer as well. Lastly, I want to talk about dietary salt intake. So those who consume the highest amount of dietary salt compared to those who consume the lowest amounts had a 25% increased risk of cancer, stomach cancer specifically, and there was also an increased risk of esophageal cancer as well. I also want to touch on obesity. Recent work, interestingly enough, has showed that overweight or obesity, as measured by weight or BMI or body mass index, is not necessarily attributed to any increased risk of cancer, but rather it's the visceral adiposity. So this is the fat that covers our organs that contributes to abdominal adiposity or abdominal fat. This is attributed to increased cancer risk. Specifically, it's associated with a 42% increased risk of colorectal cancer, as well as a 32% increased risk of lung cancer, as well as a 6% increased risk of postmenopausal breast cancer. Researchers looking at women diagnosed with breast cancer, this is following a breast cancer diagnosis and following them for 9 years, they found that these women who were able to maintain, or compared to women who were able to maintain a stable weight, those who actually gained a weight of 6 pounds after their breast cancer diagnosis was associated with a 35% increased risk of death from breast cancer. And they also found that as the weight increased, so those who gained more than 6 pounds, they had an increased risk of death from breast cancer. Similarly, when they looked at men and comparing those who were able to maintain a stable body weight again to those who gained more than 4 pounds, they found that those people had twice the risk of developing a prostate cancer recurrence. So from such studies, we can extrapolate the importance of maintaining a healthy body weight, not only for cancer prevention, but also following cancer diagnosis to prevent recurrence as well as improve overall well-being. So why should we be paying attention to our diet when it comes to cancer? I really like the statement from the World Health Organization. So between 30 to 50% of cancers can currently be prevented by avoiding risk factors and implementing existing evidence-based prevention strategies. So this includes maintaining a healthy body weight, eating a healthy diet, regular physical activity, reducing alcohol and tobacco use, and other environmental exposures. A study looking at assessing the highest quality diets assessed by the Healthy Eating Index compared to those who had the lowest quality diets, they found actually that with the highest quality diet, it was associated with a 16% decrease in cancer incidence. And then among cancer survivors, the highest quality diets was associated with a 12% reduction in all-cause mortality. So this is death by all causes, and then also a 10% reduction in cancer mortality. So as you can see here, there is importance in terms of eating and reducing cancer risk, as well as other risk factors like preventing any heart complications, heart disease, and such. So what is the ideal diet? There is growing information and research suggesting that a Mediterranean diet can lower cancer risk. Some of the benefits with the Mediterranean diet is that it reduces inflammation. It's high in antioxidants, which can prevent oxidative damage. It helps to maintain a healthy body weight. It's high in fiber, and we talked about how important fiber is in the past. It helps to regulate blood sugar balance, prevent the development of type 2 diabetes, also supports a healthy gut microbiome and a healthy immune system, which is one of our primary ways of fighting off cancer. It also helps to lower cholesterol levels and risk of heart disease. And then lastly, it does reduce the risk of cancer, and we could go into more detail. With this study, it was a 2020 review. It included 117 studies overall and over 3 million participants. And they concluded that those who consumed the Mediterranean diet or adhered to it the most had a 13% decreased risk of cancer death overall, and also a 6% decreased risk of breast cancer, 17% decreased risk of colorectal cancer, 44% decreased risk of head and neck cancers, and the list goes on and on for lung cancer and bladder cancer and stomach cancer as well. So what consists of the Mediterranean diet? Now you can find on the internet a lot of different resources on the Mediterranean diet and what you should be eating and how many servings you should be having of each food item. But I really do like this diagram here because it does show you a more flexible way of eating a Mediterranean diet or adhering to a Mediterranean diet. It offers a lot of flexibility, and it's a more simplified version of how to implement this into your current diet. So the Mediterranean diet includes lots of fruits and vegetables daily, along with whole grains. So this includes whole wheat, oats, quinoa, and brown rice, beans, nuts, and seeds. So you could have ample amounts of this every day. And then approximately 2 to 3 servings weekly of fish and seafood, poultry and eggs, as well as you could also have a little bit of cheese and yogurt as well on a weekly basis. And then things to limit or keep to a minimum is the red meats. We talked about how red meat can increase the incidence of cancer. So that's one thing to avoid or limit. Also processed meats as well. Alcohol, keep that to a minimum as well as any added sugars, desserts, and also keeping salt intake to less than 1 teaspoon a day. Another thing is processed foods as well. So next, we're going to talk about functional foods in terms of cancer prevention. Functional foods are particular foods that have been linked to lowering cancer risks. In particular, they work by improving the immune response, reducing inflammation, promoting detoxification, protecting our DNA from oxidative damage. And there's also been laboratory studies showing that these specific foods have been effective in either indirectly or directly blocking tumor growth. So some anti-cancer foods to incorporate more into your diet include garlic, and this can also include leeks and onions. They're also in the same category. Lots of cruciferous vegetables. So this includes broccoli, kale, cabbage, and cauliflower, as well as Brussels sprouts. And these cruciferous vegetables work to help our liver detox any excess toxins or even hormones as well, which can be especially beneficial for reducing the risk of hormone-related cancers like breast cancer and prostate cancer. Mushrooms such as shiitake and maitake, and even white button mushrooms. There's some research for white button mushrooms and prostate cancer for preventing prostate cancer incidence. But mushrooms have been especially beneficial for helping to improve our immune response. So this is the primary way for our system or bodies to fight against cancer. So by improving our immunity, it helps to better able to prevent any sort of cancer development or prevent the growth of cancer as well. And lastly, green tea has a lot of powerful antioxidants that has been shown to reduce the spread and the growth of tumor cells in laboratory studies, and has been shown to reduce the risk of such cancers like stomach cancer and lung cancer and breast cancer. So oftentimes I do recommend, having 3 or 4 cups of green tea a day. Next, I'll be going over some of the frequently asked questions associated with diet and nutrition and cancer risks. So we'll start off with soy. Oftentimes, both men and female are told to avoid soy because of its estrogenic effects. However, when you look into clinical trials, so the research does indicate that soy consumption is associated with a reduction in risk of breast cancer as well as prostate cancer. And even in those who take it after the breast cancer diagnosis, it was shown to help prevent the recurrence of it. So this is most likely due to soy binding to the estrogen receptors more weakly than estrogen itself. So when soy binds to the estrogen receptor, it actually inhibits estrogen from binding to these receptors, and that's why we see a benefit here. What about alcohol intake? So in terms of alcohol intake, any consumption of alcohol does increase risk of cancer, and the risk does increase as you drink more. So this means, sadly, that there's really no safe amount of alcohol that can be consumed here. In terms of wine, there's interesting research surrounding wine. Higher consumption of wine does seem to contribute to elevated breast cancer risk. However, lower doses, such as 1/3 of a cup a day, does seem to have some protective effects, most likely due to the polyphenols and resveratrol content within the wine. What about coffees? So maybe a lot of us are happy to find out that coffee is actually rich in polyphenols and has protective effects against certain cancers like liver cancer and endometrial cancer, prostate, oral, and colorectal cancer. The one thing to note with coffee consumption is just to be mindful of any added sugars in coffee drinks. This is a very common question I get, is if I should avoid dairy. There seems to be some conflicting evidence surrounding dairy consumption and dairy consumption in general and the risk of cancer development. There is actually evidence of protective effects associated with fermented dairy products. So this includes cheese and yogurt. So if you would like to consume dairy, I would say cheese and yogurt is okay in moderate amounts. And it's best to really choose organic products that don't contain any residual hormones or antibiotics or pesticides. This is also another big question, is if I should avoid sugar and carbs. So carbohydrates, when we eat them, it gets broken down into sugars in our body, and that's the primary fuel source for our cells to produce enough energy for us to sustain our daily activities. But sugar in excess amounts can contribute to diabetes and weight gain, which is associated with the elevated risk of cancer. So rather than eliminating carbohydrates entirely from our diets, I would say focus on reducing simple carbohydrate intakes. So this is the white pastas or the breads or the white sugars. Reducing that and incorporating more of the complex carbohydrates. So this includes fruits, vegetables, whole grains, and beans. And this can help to stabilize blood sugar levels, and it also has additional cancer-fighting nutrients. If you do have a sweet tooth, some alternatives are lower glycemic index options, including dates, bananas, or monk fruit. Even stevia and xylitol are some good alternatives as well. What about eggs? So again, we have some mixed data on eggs. Some have find no association between egg intake and cancer incidence, but some studies have found that, in particular, in one study, they found that consuming 5 eggs a week was associated with increased risk of breast cancer and ovarian cancer. And then men who consume 2.5 eggs a week, or more than 2.5 eggs a week, was associated with 81% increased risk of lethal prostate cancer compared to those who consumed less than half eggs per day, or sorry, a week. Similarly, those who consumed more than 3 eggs a week was associated with increased risk of gastrointestinal cancer compared to those who consumed less than 3 eggs a week. So based on these studies, I would say that egg consumption can contribute to elevated risk of cancer, but the data is still mixed, and maybe it's best to limit our egg intake to less than 3 or 5 a week. But more research is definitely needed in this area. So what about intermittent fasting? Intermittent fasting has really become a trend lately. And in terms of cancer, preliminary studies have shown that prolonged fasting is safe and potentially capable of decreasing toxicity associated with chemotherapy, as well as having some benefit towards reducing tumor growth. However, intermittent fasting is not suitable for everyone, especially if you have diabetes, if you have unintentional weight loss, fatigue, or any history of disordered eating or mood disorders. Should I be vegetarian? So a plant-based diet is probably the best for cancer prevention, but it's hard, actually. It's very important to eat enough protein to meet your energy needs. And sometimes this can be very difficult when you're on a strictly vegetarian diet. So if that becomes more of a challenge for you, it may be important to incorporate maybe poultry or fish into your diet, just to make sure we're meeting our protein requirements for the day and having enough energy. And so that's my take on vegetarian diet. And lastly, I want to touch on the keto diet. With the keto diet, there is currently no conclusive evidence to support its use for improved survival in cancer patients. So there are risk factors associated with being on a keto diet, like losing weight, and then some of the side effects that we normally see with being on the keto diet is, having flu-like symptoms and constipation, which might not be for everyone. And the keto diet is especially difficult to adhere on or to continue as part of a treatment plan. So it's not for everyone, and it's very challenging to maintain this diet. Lastly, I want to go over 6 practical tips for a healthy and sustainable diet. So number 1 is the power of small changes. So this is very important. You don't want to go cold turkey and start revamping your whole diet all at once, because you're less likely to adhere to it. So maybe the best way to go is to start with maybe having a goal for the week. For example, like having 2 servings of vegetables a day this week, and then amping it to maybe 3 servings a day the next week. Or you could start off with building a healthy balanced breakfast the first week, and then moving towards having a healthy balanced lunch the next week, for example. Next is making healthy swaps. So instead of having desserts, you could opt for fruit instead, or instead of having pasta, you could opt for quinoa. Meal prep. Meal prep is very beneficial in many ways. It can help save time. It could portion control, so it could limit us from eating or overeating, and then also from making poor diet choices when we're excessively hungry or having these cravings. And that goes for having healthy snack options available as well. So when you have healthier snack options available, things that you have in your bag or in the fridge that you could quickly grab when you are on the go or having cravings, this could help limit any poor choices when it comes to diet or overeating as well. Another thing to do is to ask before you eat. So ask yourself the following questions. Why am I eating? Am I really hungry, or am I eating because of another reason, potentially because I'm feeling some sort of way, for example? And will eating this really nourish my body, or the opposite? So that's some important questions to ask before you eat. And then lastly, and I think this is the most important part, is to eat foods you love. And this is really the key to maintaining a healthy and sustainable diet. All right, so we've reached the end of this presentation today. If you would like to reach out to me, my contact information is on the slide here at the bottom right. You could email me, or you could reach out to Higher Health Center as well. Yeah, and I do offer a free 15-minute consult as well. So if you have any questions following this presentation today, you could schedule or book in a free 15-minute consult. Otherwise, I hope you have a great day.